ओके, स्टार्ट कर दीजिए। मैं ઓડિયો ઓફ છે કે ચાલુ? ઓડિયો ઓફ છે યાર. ટર્ન ઓડિયો. હતો
So, hello everyone, and welcome to today's webinar by Homeopathy 360. A warm afternoon to our esteemed guests and colleagues. Hope you are all safe in this lockdown period. Welcome to the webinar by Team Homeopathy 360. For all of you joining us and already joined, I, Dr. Yashika Arora, heartily welcome you all. I will be the moderator of today's session for all of you. But before we begin, I would like to introduce you to BJN's online education platform, that is Homeopathy 360, Treasury of Knowledge and Hidden Talents. It is one of the most updated portals for online publication of all kinds of course material, latest news, events, career opportunities, updates, articles from great practitioners as well as upcoming practitioners, periodic literature, journals, presentations, videos, etc. We have always tried to connect homeopaths worldwide and broadcast the talent, aiming the advancement of homeopathy as an evidence based science. Homeopathy 360 has been an exceptional education hub for each generation of homeopaths, whether he's a clinician or a researcher. We try to organize each single information related to homeopathy and make it universally accessible. For this, you can also visit our website, that is www.homeopathy360.com. But before we start, I would like to acquaint you with our team members, who will be working behind the scenes while we conduct this webinar. I welcome Dr. Rajesh, who's with us, and he'll be with us at the backend system to ensure that the webinar runs smooth. Welcome, Dr. Rajesh. And not testing much of your patience, let me tell you one thing, that you have a chat box on the right upper corner of your screens where wherein you can type your questions and send to us by pressing the button next to the box. Also, we'll be running a question answer session at the end of the webinar where you can clarify your queries. You can raise your hand from that right upper corner. You have an option of raising the hand if you want to share and ask the questions. So before wasting any more time, now I would like to introduce you to our dignified speakers of today's webinar. We have two speakers today. So first of all, I would like to welcome Dr. Hitarth N. Mehta. He is DHMS in he was he got DHMS in 1997 from Gujarat State Council of Homeopathy. He's MD Home in Materia Medica from SP University Anand, and presently he's working as the principal and hospital superintendent in the department of practice of medicine. He's there as an HOD and at Rajkot Homeopathic Medical College, Rajkot. So welcome you, sir. Kindly proceed with the webinar. Now I would like to request you to take up from here.
Thank you, Yasir. Hello, good afternoon, all of you. We will start with the presentation. First of all, what we are is our emphasizing the homeopathic science. We will start my presentation with the Hahnemannian oath. On my honor, I swear that I shall practice the teachings of homeopathy, perform my duties as a physician, render justice to my patient, help the sick, whoever come to me for treatment. May the teaching of Master Hahnemann inspire me, and may I have the strength to fulfill my mission as a homeopath. Welcome all of you in webinar which is organized by the B. Jain Publishers. I am thankful to B. Jain Publisher for organizing such a wonderful event. And today my topic is exploring the clinical aspect of allergies and asthma with homeopathy. So these three words, that is allergy, asthma, in contrast with homeopathy. First question which comes in our mind, what is allergy? Most of the allergic disorders, which is caused by hypersensitivity of the immune system. Typically, harmless substance in the environment, which brings on allergy. So in modern medicine, any external morbific agent or person who are exposed to any allergens, which brings on the susceptible or subject to the allergy in a given case. So common allergens, which includes pollen from grass, weeds and trees, animal products, which includes pet, dander, dust mite, certain food which causing sensitivity and allergy, that is wheat, nuts, milk, shellfish and egg. Insect sting can bring out allergy, and certain medication. The pathophysiology of the allergy is that it involves the immunoglobulin, that is antibody IgE, the part of immune system that is binding to an allergens when a person is exposed to any allergy or any allergens. The receptors on mast cells or basophil, the triggering and causing inflammatory process, and chemical compound which liberates, which is known as histamine. I am giving the list of allergic disorders: allergic rhinitis, urticaria, atopic dermatitis, allergic asthma, hay fever, allergic conjunctivitis, eczema, and allergic sinusitis. As you know, 5th of May is the day of bronchial asthma, the world which is celebrated as the world of bronchial asthma. So I choose this topic because of yesterday only, the day which was celebrated by entire nation. So my topic is allergic asthma. In that particular things, usually the pathophysiology of IgE mediated mechanism, immune mechanism, the diagnosis of allergic taste, which has been immunoglobulin, that is allergy and sensitivity, and skin sensitivity test. For any person who are undergone with the allergies, the certain medication is to be useful in order to treat the allergy in a given case. The first is antihistaminic drugs, corticosteroid, immunotherapy, and emergency epinephrine. My topic is, what is the role of homeopathy? Homeopathic point of view, that is allergy. How you can correlate in terms of homeopathy, that is allergy to idiosyncrasy. What do you mean by allergy? It is the concept more related to immunological hypersensitivity reaction, that is immunoglobulin, IgE antibody, that is which liberates histamine. While idiosyncrasy, it is a state of hypersensitivity and hypersusceptibility. When patient or person is susceptible to external environment. So in homeopathy, it is very important whether patient is susceptible, vulnerable, means vitality is depleted. When our vitality or vital force is depleted, the external morbific agent which harbors our body and patient vitality deranged, vitality depleted, brings on idiosyncratic patient, brings on disease. That is the concept of homeopathy. While allergy, which can be treated with antihistamine in case of homeopathy, but we need a constitutional remedy to treat the idiosyncratic patient. My topic for today's topic, that is my topic, that is bronchial asthma. What do you mean by bronchial asthma? Bronchial asthma is characterized by, it's a paroxysm of dyspnea. Bronchial asthma, which is characterized by, it is a paroxysm of dyspnea. Paroxysm means dyspnea which starts suddenly, which results from narrowing of bronchial airways by muscle spasm. Narrowing of bronchial airways means bronchial constriction takes place. Whenever bronchial constriction takes place, the patient is presenting with dyspnea or difficulty in breathing, that is breathlessness. Whenever there is patient is exposed to any allergens, any allergy, any pollen, dust, fumes, strong smell, the mucus secretory gland, it liberates the mucus during the trachea and bronchi, and mucus gets plugged in the trachea because of salivary secretion, mucus secretory gland, which liberates the mucus, and mucus gets plugged in the bronchi, which resulting into dyspnea with wheezing. So dyspnea, wheezing, and third is cough. Cough means we have to acquire whether it is dry cough or productive cough, being a homeopaths. So bronchial asthma is characterized by its paroxysm of dyspnea, means dyspnea which starts suddenly, which results from narrowing of bronchial airways, means bronchial constriction takes place by muscle spasm, mucosal swelling, and viscid secretion. These are the three reasons in which patient is presenting with bronchial asthma. So as I told earlier, the main three symptoms, that is dyspnea, cough, and wheezing. These are the triad of bronchial asthma. Now I would like to reflect the classification of asthma, bronchial asthma. The first types, that is extrinsic asthma, that is atopic asthma. This is the most common type of asthma. It usually begins in the childhood, that is early life. Hypersensitivity to various extrinsic antigenic substance or allergens, all allergens, which is responsible in a given case. So extrinsic asthma, which is very common type of asthma, which is day to day, we are consultant, we are used to that particular patient in our OPDs. So we have to treat that particular allergy in a given case. We have to treat the atopic asthma in a given case. The second type, that is intrinsic asthma, that is non-atopic one. This type of asthma usually develops later in adult life. It refers to those cases in whom excessive IgE production cannot be demonstrated. IgE immunoglobulin, which is more IgE, which is increasing in extrinsic because of allergic response in extrinsic asthma, which is not there in case of intrinsic asthma. The most of the patient of the intrinsic asthma typically complex after an upper respiratory tract infection by viruses, URTI, that is acute bronchitis, and any associated infection patient may be presenting. And third type, that is mixed type. Either patient is having extrinsic asthma and intrinsic asthma. Bronchial asthma is a general term. First of all, we have to acquire whether it is bronchial origin or cardiac origin. Sometimes patient gives history of dyspnea, might be coming with because of cardiac origin, cardiac asthma. So we have to clarify in a given case whether it is bronchial one, bronchial asthma, then atopic one, that is allergic asthma. So in case of allergic asthma is an extrinsic asthma. It's a atopic asthma. It is early onset asthma. Usually early life used to trigger the allergic asthma. As I told earlier, the responsible allergens, which is absolutely necessary in order to suffering from allergic asthma in terms of modern medicine. One person is exposed to any allergens, we have to acquire that particular allergens from the patient, and according to allergens, we have to advise the patient to avoid that particular allergens. The incidence or prevalence rate of the asthma, bronchial asthma or allergic asthma, which is 2:1, which is more in male as compared to female. The atopic asthma is having divided into main two variety. So the first variety, that is involvement of respiratory tract itself, and second variety with involvement of besides respiratory tract or extrapulmonary other than respiratory tract. With involvement of respiratory tract, the person is suffering from rhinitis, and second is laryngeotracheobronchitis. When patient is not giving any respiratory tract involvement or extrapulmonary manifestation, either from skin, that is dermatorespiratory disorders, either GI tract and miscellaneous. Allergic asthma, as I told earlier, the main cause, that is pollens, that is dust and pollens, molds, person, or it is very common in farmers. Food, certain foods are sensitized. Occupational hazards, certain occupation or certain professional, we are continually exposed to that particular allergens, which brings on allergic asthma. But in terms of homeopathy, that considered as a exciting cause, and that exciting cause which excites acute condition and disease, which when it remains continuous, it becomes your maintaining cause, and we have to try to find out that maintaining cause. And maintaining causes are the causes which are continuation of the patient ailments. We have to find out the miasm, responsible miasm in a given case, and give miasmatic, anti-miasmatic remedy, and to treat in case of homeopathic science. The second cause in allergic asthma, that is some certain irritants, exercise which induces allergic asthma, cold in general aggravation, cold air which brought on the attacks of the allergic asthma, certain infection, that is respiratory tract infection, which is very common. Patient on the change of weather, patient brought up allergic asthma. Any emotional stress, that is very important for homeopathic point of view, and certain drugs which can produce the allergic asthma, that is aspirin, NSAIDs, that is non-steroidal anti-inflammatory drugs, beta blocker, that is atenolol, propranolol, pharmaceuticals, preservatives. So these are the various triggering factor of the allergic asthma. I told earlier, these are the mast cell, basophil, person is exposed to sensitization to allergens, which brings on asthma. And the thing is that allergens triggering asthma, the immediate phase, that is end phase, the mucous secretory gland which liberates the mucus, it gets plagued in the throat and bronchi and causing dyspnea, cough and wheezing. And we have to acquire whether it is from dry cough or productive sputum, breathlessness and type of breathlessness. Now signs and symptoms, as I told earlier, recurrent episodes of wheezing, shortness of breath, chest tightness or pain, coughing, difficulty in speaking, patient cannot able to speak, any respiratory disorders, either pulmonary tuberculosis, either bronchogenic carcinoma or asthma. The main seat of the action, main presenting sign in a given case, that is difficulty in speaking. Patient cannot able to speak properly, which is worse at night, which is very important in terms of homeopathy. The early morning cough, response to exercise or cold air, usually sometimes it provokes by the smokers, that is smoker's cough. Most attacks typically last for a few minutes or hours, and there is typical asthma which is not responded with any treatment. It is known as status asthmaticus. The history and evaluation, we have to evaluate that particular patient in terms of modern medicine. Careful history taking, that is ODPC, onset, duration, progress, causation. LSMC, that is location, sensation, modality, and concomitant. Physical general, mental general, physical particular, mental, and thermal modality, and we have to form the totality in a given case, and we have to analyze that particular case and give the value of the symptoms, and we have to evaluate ourselves being a homeopaths. So allergic asthma, which can be treated with the homeopathic science, and there is no medicine in case of allopathic or modern medicine. They are just give the antihistamine, and it will subsidate the episodes. The physical examination, patients is upright to upright position, that is usually involved by the patient himself or herself in a given case. The breath sound, which is obscure with lots of added sound, means sometimes rhonchi, which is presenting in a given case. Rhonchi is a respiratory adventitious sound. Wheezing, which has been already discussed to you. And second, musical sound, which is rhonchi. It is best heard during inspiration. Sometimes it has been heard during expiration also. Expiration will be prolonged in allergic asthma. Sometimes patient is not treated in time. The patient might be going to the chronic state or chronic asthma. The shoulder are rounded, chest is barrel set. Usually the patient is of small stature. Usually patient breathe from his mouth only, and wheezing is presenting, and coughs more at night, varying amount of the mucus and plug in a given case. The laboratory investigation, because of allergy, the eosinophil count, which is increasing, and sometimes patient is presenting with marked eosinophilia and absolute eosinophil count with increased ESR because of allergic manifestation. Skin test, provoking skin test, and sputum examination. If there is associated infection, either tuberculosis, either bronchogenic carcinoma, then you can think of sputum examination in a given case. Okay. Next is PFT, pulmonary function test. That is very important. That is spirometry, which estimate our force vital capacity, FVC. The capacity of the lung, that is RV, that is residual volume, it can be measured with the help of the spirometry. It estimates the narrowing of the patient bronchial tube by checking how much air patient can exhale after a deep breath. So DD of the allergic asthma, that is COPD, chronic obstructive pulmonary diseases, tropical eosinophilia, constructive bronchiolitis, and cryptogenic pneumonia. There are certain disorders which is very common in a given case, and which might be complicated to that particular asthma. Sometimes the cardiac disorders, associated cardiac disorders, sometimes the level of the potassium which has been disturbing, and patient goes into the level of the potassium which is decreased. So hypokalemia, cardiac complication, that is these arrhythmias from hypoxia, means lack of oxygen carrying capacity, which brings on stress, and stress induced causing asthma or allergic asthma. The treatment of the choice are, that is derifylline, terbutaline, salbutamol inhaler, one more, that is histoglobulin injection, which has been given nowadays, which has been given frequently to treat any allergic manifestation, and bronchodilator, which has been useful. The homeopathic approach to allergic asthma, you know, Jeticant, the concept of the Jeticant is mind is the key to the man. We have to, first of all, we have to acquire there is no need of whatever patient is suffering from any disease, but we have to acquire whether it originates from mind or psyche of the patient. Mind is the key to the man, and it should be balancing between the environment and individual disturb. So every patient is individual from one to another. Every person is like a unique, and we have to differentiate that particular things in a given case. So one more, J.H. Clark, homeopathic view of asthma. Attack of asthma may looking like the generally does look like an isolated events in a patient history. So we have to just look into the morbid state of the patient, that is sick looking in a given case. When we can talk regarding the therapeutic purpose, which are the drinking remedy for the asthma. The first remedy that comes in mind is aconite. Miasmatic evaluation, which can be compared. Aconite is a remedy for whenever patient is having draft of cold wind, which is aggravated, and great restlessness is an acute remedy. So whenever patient is presenting with status asthmaticus, you can think of aconite. Second remedy, that is antimetard. For throat-pit phlegmatic person, the hydrogenate constitution you know already, and you can think of antimetard when rattling in the chest. Third remedy, that is ipecac when the dry spasmodic constricted and asthmatic. So these are the main miasmatic evaluation when patient is presenting with sneezing, wheezing, cough, expectoration, shortness of breath, chest pain, tiredness, cyanosis, digital clubbing, telangiectasia, and X-ray finding which is normal. As such, there is no much any findings which has been observing during X-ray chest. Sometimes whenever there is any associated infection, you can think of taking aid of the imaging in case of allergic asthma. The repertorial approach. What is the importance of repertory in a given case? The Kent's repertory is given the rubrics: respiration asthmatic, respiration difficult, respiration impaired, that is obstructed. Boger repertory: respiration asthma, attack during bronchial recurrent, that is usually taken care of. So whenever there is any asthmatic complaint in a given case, you can think of that particular remedy. When we are in search of so many symptoms, and they are usually when we are looking to the patient in a given case, usually there is so much acquiring from the we have to acquire whether patient is suffering from which disease, which are the symptoms is to be prevailing in a given case, which are the thing is to be managed in that particular things, either any external morbific agent which has been presenting or not. These are the things which has to be observed. Now I am switch on to the Boningason therapeutic pocket book, that is respiration of oppressed, and there are rubrics which has been mentioning by the Boningason. N.M. Chaudhary is nicely described the different rubrics of the asthma, that is therapeutic index and concomitant. Homeopathic therapeutics, which has been already discussed to you: aconite, arsenic, midday midnight aggravation, better by heat, Kalicar, that is 1 to 2 am aggravation. One small case I will be presented to you. Patient is having history of 47 years, Hindu male, by occupation is farmer. He has a complaint of cough since 1 year and tightness of chest which is aggravated by cold and better by heat. Patient is very restless at times and using sensation of tightness in chest and whistling sound due to constriction of trachea. So the patient is having this important modality. The thermostat patient is chilly, bath with cold and hot in monsoon, winter that is +1, fan that is yes in summer, monsoon and winter that is not much required, the vitals which is normal, and patient is having a symptom which is important symptom in a given case is that mental symptom, that is emotional, fear of death due to illnesses, peevish and easily angered, intellectually fastidious by nature, they want everything in order, behavior that is extremely restless and irritable, patient suffers much and he decide to commit suicide, and aversion to meet people. Sometimes we have to take in the consideration of the different rubrics: investigation, need of investigation, that is CBC, blood allergen test, URTI, that is DD, upper respiratory infection, provisional diagnosis, that is allergic bronchial asthma, and the symptom which I have to consider in a given case is that fear of death due to illnesses, want everything neat and clean, extremely restless and irritable, wheezing respiration with cough and frothy expectoration, sensation of tightness in chest, whistling sound due to constriction of trachea, desire for warm food and drink, rice watery foul smelling stool, sputum which is scanty and offensive, aggravation by cold things, 12 to 2 am PM aggravation, better by heat, and thermal that is chilly. So totality which I form in a given case, and I prescribe the remedy, that is arsenical. There is a difference between arsenic and lycopodium. Both the remedy runs very similar in a given case. The patient is having lean thin debilitated constitution, and patient is having midday midnight aggravation which is better by heat which is also presenting in case of lycopodium. The symptom which I consider in over here is that mind restless, mind anxiety, mind fear death of mind fastidious, general food and drink warm food which is desired, general cold aggravation, stool odor offensive, stool watery, respiration wheezing, expectoration order, expectoration frothy, chest constriction, bend as of. And on that particular ground, I prescribe the remedy that is arsenic aloe. And arsenic aloe 200, 1 week interval will be was prescribing, and patient is improved with the help of the arsenic. And repertory which has been based on the radar software and synthesis repertory has been used. So these are the presentation. I'm thankful to BJ Publishers for providing me such a wonderful platform. Thank you. Thank you all. Thank you, Asika. Hello. Hello.
Thank you, sir. Thank you so much, sir.
Hello. Can you hear me, madam?
We'll be taking. Yes, sir. I can hear you. You can hear me.
Okay. Thank you. Thank you, madam. Thank you, madam.
Thank you, sir. So let's begin with the. Without wasting any more time, we'll be running the question answer session in the end from the
Oh,
speaker, where you can put up your questions, whatever doubts you have. We have our next speaker with us, Dr. Ashish G. Mehta. He's professor of Organon of Medicine, principal and superintendent, executive director and academics from Swami Vivekanand Homeopathic Medical College and Hospital, Bhavnagar. I welcome Dr. Ashish with us. Dr. Ashish, are you here?
Yeah.
Thank you so much, sir.
am I audible?
On behalf of our whole team, I welcome you all. I welcome you. Please
Thank you.
proceed with your lecture.
Thank you. Can you please upload my slides? Hello.
Sure,
Yeah,
I'll
yeah,
share.
yeah, Dr. Ashish sir. Yeah.
Case number 1, please.
No, Dr. Ashish, you need to click on the slide option. I believe you have uploaded your PPT. Just click on the
Yeah.
slide option.
Yeah, I have already uploaded, but it is not coming.
Yeah, I guide you further. What you need to do, just click on the slide option and you will have the list of all the slides. Then click on the, you can see where the slides are appearing up. Choose the PPT, click on that. And below that, there is the option of preview the presentation.
I am having Hitarth slide over screen.
That means your PPTs are not uploaded. Just click on add a new presentation.
Okay. And I have to give name also.
Yes, you need to give a name.
Okay. So just a moment.
Okay, so you just do the process, sir. Meanwhile, I asked Dr. Yashika to guide the audience. If
Yeah.
in case they want to, if in case Dr. Yashika want to update the audience.
Will it take time, Dr. Rajesh?
Um,
A minute or two. So
A minute or two it will take. Meanwhile, anybody have question regarding especially homeopathic aspect of allergy and immunological diseases, so they can ask me.
yes.
So anybody having any questions from him on allergy or immunological disorders, please ask from Dr. Ashish. So
Even
once the
even
PPT is uploaded, we'll be in the session.
Dr. Yashika, I suggest audience that if in case they want any point to be interrupted in the presentation of Dr. Ashish, they can suggest anything so that by his experience he can guide the audience.
So basically, if I have to share, I can share. Should I start?
Yeah, you believe that in the slide option
Yeah.
that PPT is
Yeah.
visible and click on the preview button.
Yeah, at present it is not visible. It is uploading, so I can share my experience with the allergic disorder
Yeah,
as
please.
well as
Please.
immunological disorder. That most of the time, what I have observed that in all the cases of either it of allergic origin or of immunological disorder, one has to take a very detailed case history. It is one of the most important step toward analyzing the case, because if we have not taken the good case, then nothing will happen to the case. We cannot do anything to the allergy or immunological disorder. So my sincere request to all the learners, including all the students and new beginners, that they have to start very good case taking in that process. So now my slide has already uploaded, so I start sharing or previewing. Previewing I should start.
Yes, click on that.
Yeah,
Click
I
on
have
the
already
preview. Click on
preview.
the
I have.
preview button. Yes.
Yeah. So then start.
Yes.
Okay. So
Yes.
this
Yes.
is what
We are able
we.
to see your PPT.
Yeah. Okay. You can see both slide as well as me both.
Yes. Both.
Yeah. So this is a case of allergic reaction, especially after taking allopathic medication. So she was suffering from ringworm and she has started treatment from a dermatologist. Then she has gone to another dermatologist also, but somehow the medicine has not suited to her and she developed severe kind of the allergic skin reaction. And that's why dermatologist has advised to stop all the allopathic medication, and fortunately she has opted for the homeopathic treatment, and she came to me on the date 26th December 2013. So this is what the first photograph what I have taken, that part. I will show you the close up also, and that is what on the back of the hand. So this is what it looks like on the day of before starting the treatment. And it is not only the one part, it is all over the outer surface, or we can say lateral surface of the whole body. So one can see the all the photograph and it is intensely itching eruption, and she was not sleeping properly, also not having good, at least good times, and that's why she has came for homeopathic treatment. So this is what the past history that I have already told, that patient was taking allopathic treatment from ringworm from a dermatologist. After 2 weeks she developed the allergic reaction all over the body, and dermatologist advised to stop allopathic medicines. That is what a really very wise decision from a dermatologist, as he knows that this is a drug reaction. So here what the homeopathy has to do, and we have to prove the efficacy of homeopathy. So the patient name I have not given because of the privacy reason, and the age was 47, that is almost menopausal age. Sex, she was female, married, and occupation, she was housewife. Moreover, she is not fully educated also, so she is almost educated up to third standard. She is not much educated, so she has given this data very slowly. So skin that is onset was sudden after allopathic medication since 2 months, on the back, on the hand, on the thigh, eruption with itching, scratching until it bleeds, and burning very much. First rash developed at one place and then all over the body. Most important modalities are mostly aggravated at 10 a.m. Then it is 2 a.m. and 2 p.m. That is 3-mark aggravation. I have purposefully note down the intensity of the aggravation also. During the sleep, it is most aggravated. During sleep means when we are our conscious mind is not playing a role, but at subconscious level also she is aggravated. Then perspiration, then tension about the disease. When she think about the disease, it aggravates the itching. And most of the time conversation or being occupied in the household work, she is relieved, and she don't remember of itching. At a concomitant level, I have taken as a menopausal age since last 6 months, because a menopausal symptoms has already started. So this Gabraman, that is means, it means some kind of anxiety plus suffocation, sweating that is 2 plus, and tension. The physical general level, she desire milks 3 mark, then fruits 3 mark, sweets 2, aversion pulses, most of the pulses she don't like. Thermal, that is hot, thirst, less, almost 2 to 3 class per day she is taking, especially when we had took the case, that is what the December, and almost in December, most of the people don't need too much of the water. It is not the May or June season where we need to drink a lot of water. She sleeps on one hand under head and menses menopause since last 6 months. While eliciting the mental symptoms, she was very concerned about her household care, family care, and day-to-day working, taking care about everybody, even when she is not healthy. When she fall ill or when she have fever, even though that also she take very good care of each and every family member. And that is what not only said by the patient, but her daughter also, who is accompanying the patient. But when angry, she becomes silent and don't talk with anybody. Anger subsides itself. That is also has been told by daughter also as well as the patient also. And that is what the advantage of having attendant with the patient. But most of the time, what I do in my practice, that first I hear the patient, and for the confirmation part or the inquiry part, I allow the attendant to be in the chamber and I ask them within, not without the presence of the patient, and if they want to say anything very frankly about the nature of the patient or the habit of the patient or the past of the patient or the present of the patient, they can elaborate very easily. That's why I always prefer that attendant must be with the patient, and I am interested to ask attendants also. No doubt it takes a lot time, but still it is required. But when angry, she becomes silent and don't talk with anybody. Anger subsides itself. She likes to do all type of work at home, and that gives her mental satisfaction and ameliorates generally. So I took the LSMC first. That Dr. Hitarth Mehta has already told about it. LSMC is also a very important part of the case, because what I consider LSMC is a one part of the presentation. LSMC is not the whole of the presentation, no doubt. According to Bonningusen, what is true for the part, it is true for the whole. But here, in case of allergy, in case of autoimmune disorder, in case of lifestyle disorder, LSMC is a part of the presentation. So first, I have taken that part into consideration, which is bothering the patient the most. That is, I have started with the most characteristic modality, that is afternoon 1 p.m. or 2 p.m. to 2 a.m. Then midnight again 2 a.m. Female sexual system, that is menopause, skin eruption herpetic, skin itching, sleep during, skin itching scratch until it bleeds and raw, and skin itching scratch must until it bleeds. This is what the presentation, and I have repertorized this part only at a first level. And this is what the results are coming, that arsenic, that already Hitarth Mehta has already described it properly. Then pulsatilla, then lachesis, then nitric acid, then ferrum, then chalidonium and curare. This all medicines are coming into the consideration, and we have to look at this consideration. This is what the medicine which is covering the part of the chief complaint, and or the LSMC, or the very important part of the whole presentation, that is part of the whole. Now we will go for the physical general aspect, so which is again a very important part. The physical generals, strong physical generals never be excluded. So at a physical general level, I took the same kind of the modality with thirstlessness, with sleep position, because sleep position are our unconscious gestures, and that is one of the most important in considering while repertorization. Food and drink, sweets, these are our taste buds, and tastes are actually the sensations, and it also suggests the neurological part also, because it carries to the nerves. So milk desire and eruption herpetic, that is at a general level. So this suggesting some another group of the medicine. That is what arsenic, again arsenic is coming, pulsatilla again coming, lachesis is again coming, nitric acid is again coming, ferrum is again coming, chalidonium and curare. These are the medicines which are coming again and again. So you we have part that is first part that is only LSMC. Then we have characterized the physical generals, that is completely a different part. Then the disease process itself, and now we will go for the mental part, that what mental part suggesting to us. This is what this methodology I have adapted in many of the cases, especially when I have to deal with the either allergic or autoimmune disorder or lifestyle disorder. This strategy gives me a very good results. That's why I have adopted this. I am not taking all the symptoms together, making totality and repertorizing it, but most of the time I make it fragmented first and then combine it all together. Okay, what is the coming and which is one of the most important remedy or the one of the most similar remedy among the group of the remedy what we are having on the repertorization table. So these three symptoms are very important in this case, that care worries full of, anger, talk indisposed to, and occupation diversion ameliorates. When she is working, when she is doing conversing with anybody, that is kind of occupation also, that is ameliorating herself, and that is again a very characteristic found in the patient. And this is what, let us see, can anybody guess which kind of the medicine can come up? One can comment on the chat box also. I can see chat box. So if anybody has any idea, I am giving 2 minutes fast. Which kind of the medicine can come up in this repertorization? Anybody have a synthesis app in the mobile one can do, because it is one of the very reliable app I have found. Anybody can write down in chat box if it is permitted by the moderator, please. Yashika, Arsal, very good suggestion. Damini Gosai. It's a good Ars again. Ajudia, Anand,
Pulsatilla.
Pulsatilla. Yeah, very different things are coming out. Good, very good. Thank you for your feedback and inputs. We can go further. So Echinacea, Pulsatilla, Illumina, Arsenic, Aurum, and Baraita Cab are coming. Unusual medicines are coming. So now we can go for the whole repertorization and let us see what is happening. Okay. So this is what I have done with all the symptoms, and all the symptoms, most of the symptoms are covered by the pulsatilla, as well as patient is hot and thirstless. That is also I have considered at the menopausal age, that is a woman. And again, what I have found in the especially ringworm infestation or ringworm infection within last 1 year, which is very predominant. Pulsatilla is working very nicely, but in lower potency, pulsatilla works very wonder in uh, especially ringworm infection. So now understanding of the case, that is prominent mental general, that is mental and physical both are prominent, physical particular with characteristic modality. The susceptibility is moderate because she is allergic reactions are showing the something abnormal susceptibility, and which is not showing so intensely or not a anaphylactic kind of the reaction, but it is throwing as a severe kind of the skin reaction. So susceptibility is moderate. Moreover, the patient is at a middle age, then the characteristic modalities are available, then the much of the drug has not been given, and correspondence or the matching with the remedy is comparatively very good. So we can take it as a moderate susceptibility. Miasm, that is soric to psychotic, because it started with the itching or allergic reaction, but at this, when you see the first two photographs, you will see the hyperkeratosis, that is a proliferative process, and that is why I am putting psychotic also. Potency, that is medium to high, because itching was so severe. So our job is to diminish the itching first, because patient is suffering a lot, and if we have to make it rapid and gentle first, the part is itching should go. So repetition is frequently because of the intense itching, and pulsatilla has been given to this patient. So treatment started with on 26th December 2013. There's 300 has been written wrong. It is 30 potency, not 300. it is not available in my place, probably available with some pharmaceuticals. So treatment started, and it has been within for a week. It has been given, and
हेलो जी जी आशीष भाई अच्छा एक्चुअली मेरा इंटरनेट यहाँ आ नहीं रहा एक्सेस नहीं हो रहा लेकिन उसकी वजह से उस पर आना नहीं चाहिए
I'm extremely sorry. There is some technical issue with the with our speaker, Dr. Ashish. He'll be joining us soon. While we sort this issue, please have some patience. I request to have some patience. I would like to request all of you to please have patience. Let's begin with the question answer session from Dr. Hitarth. We have Dr. Hitarth Mehta here. Dr.
Yeah, madam.
Hitarth, are
Yeah,
you
madam.
going to? Yeah,
Hello,
thank you
hello,
so much,
hello,
sir.
madam.
Yeah, hello. So we have Dr. Hitarth here. Anybody have queries with from Dr. Hitarth regarding his
Madam,
presentation?
madam, I am solving the query from I have seen from the chat box. The question
Sure.
is that in which potency and um, which medicine is given. The pulsatilla 30 is given on
Hello,
the base. Hello,
Dr.
hello.
Yashika, can you hear me?
Hello.
Yes, Dr. Rajesh, what happened? Dr. Rajesh, please, we have a question answer session from Dr. Hitarth. Please, till the time Dr. Ashish connects. Sir, Dr. Hitarth, please proceed, sir.
Sir has given the pulsatilla in lower potency as the disease is long-standing and chronic one. So according to susceptibility of the patient, looking to the uh, pace of the disease and the model potency which was selected on the basis of susceptibility as well as patient proneness to the disease, and pulsatilla 30 was selected on that basis, and patient is having wonderful response. Next question, Yasika.
Sir, Dr. Manik is asking, allergy also depends on susceptibility.
I have already told. Hello. I have already told there is a difference between allergy and susceptibility. Susceptibility means our susceptibility whenever person is exposed to any allergens. In homeopathic point of view, we are not bothered about the what kind of allergy patient is susceptible to. We are having the importance on the levels of susceptibility. If our level of susceptibility, which is depleted, means patient is whenever exposed to any external morbific agent, our level of susceptibility becomes low and patient is exposed to disease. So we have to just leave the vitality of the given case, immune system, and patient is in state of health. So higher the susceptibility, higher the potency. Lower the susceptibility, lower the potency. So homeopathy based on the plane of susceptibility. There is no need of knowing the allergy, which kind of allergy patient is suffering from. It is having no value in terms of homeopathy. We are having looking to the proper history taking, constitutional treatment by looking to the proneness, looking to the individuality, looking to the case, and we have to prescribe the remedy on the basis of the analysis, evaluation, transformation of symptom into rubric, and the symptom which is important to that particular patient. So on basis of that, the remedy which was prescribing, that is arsenical. Hello, madam.
Thank you, sir. Thank you. Anyone else? Any other query? Please post on in the chat box. Anybody wants to ask any query?
One question is that, madam, can allergy has correlation with the miasm? Can allergy has correlation with miasm? We should prescribe the miasm on the basis of miasmatic block. As I told earlier, whenever patient is on any exciting cause, which excites acute condition in disease, when exciting cause remains persistent, it becomes your maintaining cause. So to try to find out the fundamental cause, we should give the anti-miasmatic remedy to treat the miasmatic block in a given case. So of course, allergy inheritant, then there is need of constitutional remedy to treat in order to treat in homeopathic way. But susceptibility and constitutional role of constitution is very important in order to treat the allergy in homeopathy.
Thank you, sir. We have another question that what if we could not get the causative factor why the patient started the allergy? Can we still treat it without knowing the causative factor?
In case of homeopathy, causative factor is having prime importance in terms of repertory ailments from how disease has been started. What is the reason for pace of disease, how it gets started. But sometimes there is any provoking factor in a given case, then we have to taken into consideration what are the symptoms which is characterized to that particular patient, which are the symptoms which is PQRS, peculiar, queer, rarity and strange in a given case, and try to rectify and try to give emphasis on that particular symptoms, and we have to prescribing the remedy on the basis of that particular remedy on the particular symptom, and we have to compare that particular symptoms with the help of the analysis and to give the value of the symptom, means evaluation portion. That is very important. Most of the cases we cannot do just repetition. We have to pick the symptom which is important to the patient only, and we have to form the totality, and we can prescribe the remedy on that particular basis. Hello, madam.
So, yeah, we have another question that was on what basis we choose potencies? I think this is a long question. Potency.
Okay, Yasika. One question is that,
yes, sir.
Sir, we can treat allergy in case we can't remove causative factor. How? In modern science, patient is advised for avoid that particular allergens. If person is exposed to either strong smell, avoid that particular strong smell which brings on disease. If patient is having allergies to dust, avoid dust. This is not possible. So in case of homeopathy, we are treating as a patient as a whole, and mind is the key to the man. There are different types of the concept, and we have to adopt all the concept and try to rectify it and prescribe the remedy. On basis of that, we have to give the anti-miasmatic remedy, try to find out fundamental cause, and we have to prescribe the remedy in single dose. One more question: how miasm has correlation with inherited allergy condition and acquired allergy condition? Inherited means which is presenting since birth, and acquired means after birth. The miasm, the attributes is clearly mentioning by the Organon of Medicine by B.K. Sarkar. Sora, psychosis, syphilis. Sora means sense of itching. All the functional disorders are belonging to Sora. Psychosis means extra growth. All tendency comes under psychotic miasm. And syphilitic means destructive tendency and tendency to ulcer formation. So according to miasm, we can pick the symptoms, and we have to give the anti-miasmatic remedy. Amruta Aryani. The question of Amruta Aryani is that.
Sir, there was one previous question which was being asked by a person. Can allergies be inherited? What can be done for such conditions?
Inherited allergy, I have already replied. There is a inherited allergy means familial. Inherited means it has been present from parents only. That is been, we have to give constitutional treatment for that, and we have to take the history of the whether parents is having similar complaint which is presenting in family or not. If a sibling or parents is having similar complaint, then we have to think of miasmatic drug in a given case, so that we can able to take the that is the objective symptoms. Objective symptoms are the symptoms which are observed by observer by his or her surroundings. We have to pick the symptoms from the surrounding, from the parents, from the environment, from the family members, and we have to treat accordingly and find out the simillimum. Hello, madam.
Thank you, sir. We have more questions. Can we prescribe only of mental generals?
The mental general is having prime importance. The mental symptoms is having prime importance on Kantian base. Mind is the key to the man, as I talked earlier. Will and there is 3 grades of the mental, that is will and emotion, intellect, understanding, sleep and dreams. So according to mental symptoms, we have to see the space of the disease, life stage of the individual. Life stage of the individual, how he brought up, what is the circumstances around, how he socially attached or detached, what is the relation with the family members, relation with the surroundings. All the things has to be considered in a given case, and pace of the disease, life stage is to be considered, and we have to pick up the mental symptoms or acquire the mental symptoms having prime importance in order to prescribe the remedy on Kantian way, which is having prime importance for totality purpose. The symptom which is important to that particular patient, we have to pick that particular symptom. As I told earlier, that is peculiar, queer, rarity and strength, or keynote or characteristic symptom. Okay.
Thank you, sir. Somebody is asking, is low immunity responsible for mentally disturbed patients? I think.
Very. Hello. Low immunity, which is responsible.
Hello. Am I?
You
Hello.
back, sir? Hello. Hello. Hello.
Yeah, I am already on the screen. I am already on the screen. Are you hearing me?
Yes, sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
We are
Sir,
able to hear you.
sir, let's continue, sir. Ashish, sir.
Thank you so much, Hitarth, sir.
हाँ जी. Continue करो ना.
Yes, sir. Yes, sir. Continue कीजिए.
Okay, so we have started with the phytum for the rest of the period, and that is only one time. The second time has been given when the itching was so predominant, that is for a week, and again placebo has been given. And then comes the follow part of the whole, we can say, the response of the homeopathic medicine to this allergic reaction. So that is one part. This is on the photograph taken on the 11th June of 2014. These are the itching has already stopped, the discoloration was there, and being a female as well as the real homeopathic result can be the almost the same skin should be there, and that's why I have continued the treatment and requested her to not to stop medication. As per my instruction only, she has to stop medication unless she has to continue with the same. So these are the photograph taken on the 11th June. So these are the June follow. These are the again June follow. So here you can compare what are the differences are there. This is again in the September, that is 2/9/2014, 3 months after. These are the 2 months after, again September to November. I hope everybody can see the changes in the skin texture, the shining of the skin. So these are the picture that is on in 19 especially. One can see the change. That is the first photograph of the lady and this photograph of the lady. Almost all the skin eruption has been gone. The almost normal skin has been returned. Comparison, this is what, and at present this is what the picture of the lady. I think I have done with the case. So if anybody interested, then we can go for the second case also. But this is what the result at present obtained, and she is not suffering from any kind of the skin eruption now. The only pulsatilla 30 TDS for 2 weeks at a different time occasion has been given. No other medication has been given. No external application has been given to this child, this person. And if anybody has question regarding the same case, one can ask me, or we can go for the next case if time permits only. Hello, Yashika.
Yes, sir.
Hello.
Is
Yes.
somebody anybody have, yes, sir. Anybody is having any query? Sorry, a person is asking till the end of this case, same potency was prescribed or other? Any other, matlab, the potency was increased or decreased?
Yes, same potential. Because almost 1 week I have given pulsatilla 30 and then stop giving the phytum or placebo only, and when again itching return I again given the same potency in the same repetition for a week. So only 2 weeks of pulsatilla 30 has been given to this patient, one at the starting of the treatment and after almost 6 or 7 months of the treatment when itching was again reappeared, then only then no other medication has been given to this person. Even no intercurrents. Hello,
Great,
am
sir.
I
Great,
audible?
sir. Yes, sir, you're audible. Great. Anybody is having any
Okay.
other query?
Or we can go to
I
second
want to ask.
case also. Yeah, yeah,
Sure,
please.
sure, sure, sir.
Hello.
Sure, you proceed, please.
Shall we go? So one has to upload the slide, or I have to upload the slide for that?
Sir, you can also screen share your PPT on the option
From where to
beside.
turn?
You have an
Mukesh
option
turns
beside
screen
audio.
share.
Yeah.
This is what. But I am not seeing my window. That is what the problem.
Okay. You just upload the slide like you did before also.
Yeah.
I think I can. Yes, sir. Case 2 slide.
This case two slide. You can if you can share. Please share case two.
Sir, you can only see it. I cannot see the case 2 slide.
But where I can, I am not seeing. Okay, I am adding this presentation again.
Sure.
Just a moment. So let us see with the. Meanwhile, we can ask anything. Anybody can ask about anything regarding the
There was
treatment of allergy, lifestyle disorders, please.
there is one more question, sir. One follow-up. One follow-up. We seen back pain, pain. At that time, change. If we see back pain or calf pain, at that moment, can the person change the potency? Like he wanted to ask how you find action of the medicine is to be still continued.
So there is no back pain or calf pain in this case. What I understood. Hello, hello.
You're audible, sir. You're audible, sir.
Yeah, because my case was not presented with the calf pain or back pain.
Okay, thank you, sir. We had a query with Dr. Hitarth as well. By the time the slide gets uploaded, uh, Dr. Hitarth, can you please answer back that query which you were continuing before? I think that was regarding low immunity for mentally disturbed patients.
I had already discussed. I had already discussed. A patient is having low immunity. That means patient is having low vitality. The vitality is low. When immunity, our immune response is low, our vitality is low, our susceptibility is high. So patient is vulnerable to that particular disease. So in the case of homeopathy, there is no need of knowing the allergy, know what kind of allergy patient is suffering from. We have to just take the proper case taking, and we have to take the on the basis of the antimiasmatic, on the basis of uh, the symptom which are pertaining or which is important to that particular patient. We have to taken into consideration as a PQRS, as a sir has already given the guideline, Ashish sir. The symptom which is important to that particular patient, we have to consider that particular patient, that particular symptom, and we have to take form the totality which is important to that particular patient, and application of knowledge of disease to knowledge of medicine, find out the similar one. So there is no need of just individualization. Every person is different from one to another. On the basis of organon, on the basis of repertory, on the basis of materia medica, combine all three knowledge and prescribe the remedy on basis of that. This is the main concept of homeopathy. We have to strictly follow the knowledge of organon, materia medica, and repertory. Thank you, Yasika.
Thank you, sir. Somebody is asking I think from Dr. Ashish, can external application be used in such type of cases, like homeopathic external applications?
External application is allowed or not? That is what asking. Question is that.
Yes, sir.
Hello?
Yes, sir. Yeah, he's
Hello?
asking. Yes, sir. External application.
Whether they whether, whether external application can solve certain complaint, but when you are confident of the case, this is a case of allergic reaction. And here there is no external things are there, only allergic reaction is there. So unless and until if we don't treat them internally, there is no use of external application first. No doubt for the satisfaction of the patient or to earn something out of it, one can give any of the external application, generally almond oil or olive oil or only groundnut oil or Vaseline or paraffin, anything can be given. Even vitamin E supplementation is also very good for them. Hello? Am I clear?
Yes, sir.
Hello?
Thank you. I hope the slide would have been uploaded till now. Hello? Hello, Dr. Hitarth.
Yes, yes.
Hello? Yes, sir. Dr. Ashish, is this slide uploaded or is still left?
Saying that 2 minutes will be there.
Okay, then we have
Please
another
wait
question.
for 2 minutes. This is what the
Yeah.
message I am getting.
Somebody is asking regarding the COVID-19. I think she has a question, Dr. Priyal Kakar. If any mosquito bites the corona positive person and then bite the normal person, it spreads infection or not. So I would like to tell you, Dr. Kakar, with this we can discuss personally with the speakers. We'll be sharing the email ID of the speakers at the end of the webinar. So you can personally discuss with them. Sir, another question they have asked is, any suppression was there after the prescription of the patient when you gave pulsatilla? Or only medicinal reaction was there?
Medicinal reaction means only because of the allopathic medication or homeopathic medication?
Sir, homeopathic medication. She's asked, Dr. Sharda Devi is asking, is
So
there
patient is still in my contact. We are regularly meeting. Yeah. Already regularly checking his blood pressure and all the parameters regarding the menopausal age also. And she has established, now she is almost established menopause and not menstruated since last 1 year. So at present we are not seeing any kind of the suppression at any level, especially her daughter's feedback as well as husband's feedbacks. Also I have noted about the changes or temperamental changes that has not been noted. And that is, I can say, from the physical angle as well as mental angle and hormonal angle, that no suppression at present we are witnessing now. I think I am clear.
Yes.
Yes,
Hello?
sir. Thank you. Yes, sir. Yes, sir. Somebody is asking.
Hello.
Is it uploaded? Is the presentation uploaded, sir?
At present not uploaded. So how to screen share that I don't know.
Sir, just
so I can
see the
share
laptop
the screen of that.
Yeah, just see the laptop screen where you have an audio and video option. Can you see audio option there?
Okay.
So beside the audio option, you have another computer, a PC, an image is being formed of that picture, just beside the audio option.
Let me try first. Okay.
Yes, sir. You can try. Just click on that screen share option beside the audio option.
Let me try. Done something. So
Yes.
probably to see my slide.
Yes, sir. I can see. I can see. Yeah. Just open that. Yes, sir. Just open it full screen.
Hello. Can you
Hello.
see my
Yes, sir.
slides?
Please do. Yes, sir. I can see it. Please do the full screen option.
Whether everybody. Okay. Hello.
Yes, sir.
Is
Full
it
screen
okay or
option.
not?
Yeah. It's perfect, sir. It's perfect. You
This.
can just hide that. Hide
So
that.
this is a case. Okay. Now it is okay, na?
So perfect.
So
Perfect.
this is okay. This is a case of tubercular pleurisy, but he has a severe allergy of allopathic medication. So when most of the chest physician as well as physician treated this person, he has given AKT for that, but AKT has produced severe hepatitis and acute renal failure because of the AKT induced hepatitis and ARF. So that's why he is not able to take AKT instead of having a tubercular pleurisy, and that's how the case came to me. So this is what the history that on 20th March of 2010, patient came at college OPD, and one of the our colleague physician has phoned me that can you handle this case having severe diarrhea and vomiting with comparative dehydration homeopathically because he is not responding to allopathic treatment. So we have said yes, and he came to the our college OPD. So when he came to the college OPD, he is having this complaint that since to one day, especially GIT was affected and severe vomiting and diarrhea, can't eat anything, discomfort in abdomen, elements from allopathic medicines because he was living in a Surat, which is almost 300 kilometers away from my place, and his native is in near Bhavnagar. So he came to Bhavnagar just for visit the parents. And meanwhile, they have insisted to examine by a senior physician, and senior physician has already diagnosed the case and given the AKT again. And same thing has happened for the third time that after taking AKD, he has developed severe kind of the vomiting and severe kind of the diarrhea and severe restlessness he has started. So he has presented the complaint with this actually. So when he came, severe weakness, can't speak properly, as already Dr. Hitarth Mehta has said, when there is respiratory illnesses are there is always, we can see the some problem with the voice or speaking, can't walk properly, he has breathlessness also, and weight was 55 because already physician has told me that he is underweight at present according to his age and height. So video clip I am not showing because of the poor internet at present, but we can show, I can show you the photographs later on. So these are the history what we have get at that time, that is her 2009 he has suffered from the right pleural effusion treatment allopathic given, and again discharge summary that right pulmonary cough with severe gastroenteritis with AKT induced hepatitis was generated. That's why he was discharged and discontinued the allopathic treatment. Pleural effusion on 2010, that is 50 ml on the right side, and discharge summary again he was discharged because of the AKT induced hepatitis with ARF, and AKT was stopped, and now come with the severe vomiting after 2 days, and again only with the glucose saline and severe supplementation only one can give because AKT was not indicated in this case. And again, same history has started at Bhavnagar also. Patient referred by a physician having history of right pleural effusion with AKT. Developed severe gastrointestinal disturbance, severe vomiting and diarrhea since 1 day, severe weakness, voice changes. After taking AKT, patient can't walk properly because of that weakness. Patient is diagnosed as allergy to allopathic treatment. So patient coming from a middle socio-economic group suffering from right pleural effusion since 2009. It is a very chronic pleural effusion with tubercular origin, treated with AKT but allergic to AKT. So what to give this person? That was a question to all the physician, and they have not tried the steroids even because it is also not that much indicated at this point of time. Suffered from AKT-induced hepatitis, also mentally prefers to be in quiet atmosphere and doesn't like to be in congested place. Especially Surat city is a very congested city, especially in certain area of the city. He feels aklaman. Aklaman means a kind of restlessness with anxiety, is in congested place and would like to go hometown, especially at a village, because at village he thinks that there will be a peace, quiet, natural atmosphere and no noise. In contrast, in city, too much pollution, noise, disturbance is feel because he feels irritated and disturbed under different circumstances. Patient as a person, he is much interested in his business and would like to develop more and more. He feels that he has not enough money and thus thinks about business and mentioned that business is his hobby. When I asked about his hobbies, he said business is my hobby. So I was surprised how business can be a hobby of any person. So at that juncture of time, he has responded that I would like to earn money more and more because I feel I have not enough. He also prefers to travel to natural places and hill station where he can have quiet atmosphere and can take rest with the family. He prefers natural beauty, hill stations, farms, rivers, trees and greeneries. So rubric selected on the given history that elements from crowd society in disturb aversion to being sensitive, noise to irritability easily, business talks of delusion, poor he is, rest desire, travel desire to side right then left because already he has developed right sided pleurisy and there are chances of coach infestation spreads to left also. Chest pain, inspiration during, that is common symptom of pleurisy also. Inflammation pleura right and inflammation pleura tuberculosis during. This all are the rubric given from in the repertory. So when I repertorize the case, the Bryannia stands out very clearly, and no doubt I have almost analyzed the case to the different level also, different way also, that we can call a sensation method or system level. That also I have done that work at that time, but at present I am putting it in as a repertorization form because I don't know how many students and learners are acquainted with the many of the approaches. So what general understanding was chronic, slowly progressing disease, qualified characteristic symptoms are available, susceptibility low to moderate, potency 30, TDS for 2 days only, Brani alba has been given. Am I audible now? Hello? Hello? Hello?
Yes, sir, you're
Am I
audible.
audible
You're
now?
audible, yes, sir. You're audible.
Okay,
Yes.
okay, okay. Okay, so the first prescription was released on 20th March 2010, TDS for 2 days only. Just remember it, it is Brani Alba 30, TDS for 2 days, almost 6 doses, nothing else. And all allopathic medicine has already stopped because of it gives the severe reaction, especially at a gastrointestinal level. So diarrhea and vomiting stop on 22nd of the March. Weakness almost decreased 3 marks, sleep good, thirst 2 liters per day, appetite increased. In severe case of severe diarrhea and vomiting, when appetite increases, it is one of the best sign according to general understanding. Right ear pain behind it, there is a slight pain behind the right ear, he has complained, but I think it is a accessory symptom, so I have not given much hit to it and given placebo for TDS for rest of the days. Then again he came on after 4 days, that is on the 26th of March, and we have seen the chest X-ray that pleural effusion, right pleural effusion, but he has not developed anything regarding the vomiting or diarrhea or nothing. So again giving placebo for the patient, and for 1 month he again went to Surat. Again, he came on 17th April 2010 with chest X-ray and USG, bronchopneumonia, pneumonic changes in left lower lobe with right pleural effusion, and right pleural effusion was came down to 10 ml. From 50 ml to 10 ml it has gone, and that is what a positive sign for me. Again, I have given the placebo. On May, he again came with no reports, but he was good condition, and weight increased up to 62 from 55 to 62. When in case of tubercular pleurisy or tuberculosis, when weight is increasing, it is one of the most positive indicator at clinical level. So again in January, 21st January, he came with reports, and pleural effusion was 4.5 ml. The size of the pleural effusion has decreased, and weight again increased from 62 to 66. Then weight was 69 and 71 kg, and by USG finding on October 26th October, that was USG, that is effusion 223, and I talked with the radiologist also and said it is a negligible and you don't have to forget about it, and even say patient that you are not suffering now anymore from the pleural effusion, so forget it. So we have continued with the placebo, and weight increase up to 71 kg, and again on 24 January 2011, yeah, USG said a thickened pleura in both costophrenic angles, no pleural effusion seen in either side, that is USG, and upperward is the X-ray. And placebo has been given again for TDS and 72 kg weight, and again on 25th of April 2011, no history of any illness. He is enjoying the health, and weight increase up to 73 kg. So this is a big change according to me. So these are the photograph when I have taken the case. So this can be indicative because video will not run according to my low internet speed. So this was the first photograph I have taken of the patient on the day of consultation. This is the second one on after almost a month. This is previous one is 20th March, and this is almost 17th April. Then again it is on June. In June, these are the interns who are studying as with me. This is in August. We have taken the follow-up when the 69 kg weight was there. No complaint, weight increase up to 69 kg. On 26th October, having no complaint, weight reached up to 71 kg. Then 55 to 71 kg. You can see the cheekbone and the whole sunken look of the first photograph, and the second photograph when he's showing the sign of health, sharpness in the eyes also, and smile kind of face. This all the things has been with the only 6 doses of Briarnia 30. No medicine has been given rest of the thing. Only 6 doses of Briarnia for 2 days and no medicine afterwards. So what I conclude that indicated homeopathic medicines creates possibilities to cure advanced pathological cases allergic to allopathic medicines also. Minimum doses of indicated medicine cure very speedily, and homeopathic cures if we perceive what is to be cured in the patient. This is what my understanding. So I hope you will like this presentation. So is it okay now? Hello?
Yes, sir. I would like, yes, sir. Sir, somebody has put a query. What is
Yeah,
anti-coach treatment?
please.
Hello. Anticox treatment, that is pyrazinamide, ethambutol, streptomycin, rifampicin,
And that is reform protocol.
and DOTS also, direct observation treatment of short course. The government has been adopted and it has been freely available. AKT.
AKT. It is known as AKT only mainly. Any other question, please?
I would like to request everyone to please post your query in the chat box on the right hand side corner of your screen. If you have any queries you want to ask from any of these speakers. For the video, we'll try to share it on our YouTube channel soon if possible. I'll be sharing the YouTube link soon in the chat box before we end the session. Sir, there is a question. Is it okay to stop all allopathic medications at once? Sir, am I audible? Is it okay to stop all allopathic medications at once? Am I audible to everyone?
Hello, madam.
Yes, sir. Dr. Hitarth, can you please answer? I think Dr. Ashish has some technical issue. Please answer this question. Is it okay to stop allopathic medications at once?
If there is any associated infection which is established in a given case, then there is need of allopathic medication. If the case which comes under the scope of homeopathy, so there is no need of any allopathic medicine. Why should we start with homeopathy? Always stick to the homeopathy. Homeopathy is having wonderful result in treating the advanced pathology as well as emergency, acute emergency condition. So no need of taking any allopathic medicine in a given case. Thank you, madam.
Okay, sir. There was one more question. Thank you, sir. There was one more question. When to use LM potency? When to use decimal scale? Can you please share in short? I think this is a long topic.
The selection of the potency which has been already designated in knowledge of posology, which is nicely described in terms of homeopathy. The knowledge of posology.
Am I audible?
Audible, sir.
Now, Yashika.
Sir, you're audible.
So somebody has asked
Dr.
me question regarding the. Yeah, somebody has asked me about the
stopping. Technical issue.
Please continue. Let's continue.
Haji madam, what is the question? Yasika madam.
Please.
Hello.
Sir, for Olympic, the question is after allopathic.
Hello.
Sir, somebody is asking, is taking too many rubrics can lead to wrong remedy? Am I audible, sir? Is this taking too many rubrics lead to wrong remedy?
Your voice is.
Sir, Dr. Hitarth, you please continue. I think there is some issue with Dr. Ashish's internet connection. Please answer.
Okay,
please answer this question.
Which question, madam?
Too many rubric selection can lead to wrong prescription.
No. The rubric is the language of the repertory. We have to emphasize the symptoms of the patient. I have already told you the symptoms which is to be considered, which is important to the patient, is to be considered in a given case. Make the totality and form the analysis, then evaluation to give the value of the symptoms, and form the rubrics or find the repertory, selection of repertory. Then totality of the symptoms means portrait of the disease is to be formed according to the symptom which is very important to that particular patient, and try to find out the simillimum. There is no need of too many rubrics will spoil our case. It will help us to differentiate the one remedy to another remedy.
Thank
Okay,
you,
madam?
sir. There is one more question that is, thank you. That is, after allopathic medicine, is everyone does everyone require an antidote before prescribing homeopathic medicine?
No, no, no. It is not like that. Before prescribing the before before prescribing the homeopathic medicine, there is no need of giving the antidote to everyone, because we are having definite theory which is prescribed by in terms of Organon and
Is it question to me or Hitarth?
It is for you, sir. It is for you. Hello.
Hello.
Start answering, sir.
Sir, you can answer. If you have a good connection, please begin.
Okay, am I audible or not? Most of, yeah. Okay, so in most of immediately when you start a homeopathic treatment, because in case of epilepsy, in case of hypertension or any of the lifestyle disorder, one should not, especially in case of
So, I would like to ask everyone, is there any queries left which you want to ask? Any more queries from all the attendees? I would like to request if there are any queries you want to discuss. So I've shared my our channel's Homeopathy 360's YouTube link with you all. And sir, I would like to request you to please type your mail ID and mail ID for people to contact you in case they have more queries to solve, or shall I do the needful? Hello, sir. Can I send your email ID? You may contact for further queries on this email ID from Dr. Ashish Mehta, and Dr. Hitarth Mehta will soon send you the email ID. I have his email ID as well. So for any queries, you can discuss with the Dr. Hitarth and Dr. Ashish in person. You can also visit the YouTube channel for further updates. We'll try to post the video sooner. And for tomorrow's webinar registration, we are also organizing tomorrow a webinar tomorrow, that is of Professor Dr. Rihina Rawal from Ahmedabad Homeopathic Medical College. At the same timings, 3 p.m. So if you want to register for the same, I have sent you that link in the chat box. You can register for tomorrow's webinar at the same link. And now, before ending anything, before ending this session, I would like to thank both the speakers for their wonderful session on allergic conditions, especially allergic asthma. It was World Asthma Day yesterday, as already told by Dr. Hitarth, and today we were able to update people about asthma through our webinar. Thank you so much, Dr. Ashish Mehta. Thank you so much, Dr. Hitarth Mehta, for being with us, for taking out your valuable time. On behalf of whole
Thank you, madam.
360 team as well as BZ group, I would like to thank you both. My heartful thanks also goes to all the learners who have been with us since long and have patiently listening to both these speakers to gain knowledge they could. Before I sign off today, a very important vote of thanks also goes to the people who are behind the team Homeopathy 360. Yes, it's team Homeopathy 360 that works day in and out to bring you information related to homeopathy, and we have recently started these webinars to update people about homeopathy. Thank you everyone. Stay connected with us. Keep participating likewise. For any queries, you can contact us at webinar@homeopathy360.com. We will also try to share the recorded version soon, and we would love to hear from you all. Thank you everyone for taking out time and being here today.